My name is Dr. Esther SIMIYU. I'm a consultant obstetrician gynecologist working in Avenue Hospital, Parklands, and today we're going to be speaking about cervical cancer. Cervical cancer is a cancer of one of the female pelvic organs, and this is a cancer of the cervix, which is located on the uterus. The cervix is one of the outlet whereby the periods usually come out through, and this is where children come out through during childbirth. Usually when someone gets cervical cancer, it doesn't present with symptoms. By the time one is getting any symptoms, it's usually the cancer has already progressed into a more advanced stage, and hence it's important to speak about this today. When we're speaking about cervical cancer, our focus usually and today is, number one, early detection of cervical cancer, and number two, prevention of cervical cancer. Prevention is by way of vaccination, which is a HPV vaccination, which we'll talk about. We have three types of cervical cancer screening tests. The first one, and the commonest one that we use and we do recommend, is a cervical pap smear. The second one is what we call HPV DNA testing. And the third one is a test which is called VI-VLI. The ones that I'm going to focus on today are the first two that I have mentioned, which are the most recommended and the ones that we use in our setup. A cervical pap smear is essentially a test whereby we take a sample from the cervix. It is not common to, some myths which are there. It is not a surgery. We do not do any cutting during cervical pap smear screening. We take a sample using a brush from the cervix, put it on a slide, and the slide goes to the lab whereby they look at it to see are there any normal or abnormal cells. So this is usually done in the clinic, and it needs to be done every 3 years when a test is normal. That is how often should somebody be doing a cervical cancer screening test through a pap smear. If the test comes back as abnormal, then that means that it would need a review in the clinic with a gynecologist to see what kind of abnormal test it is, and to decide what is the next step going forward in the management of this case. The second type of screening that we've mentioned is HPV DNA screening test. Much like the pap smear, this is also done in the clinic, whereby we take a brush, it is introduced into the vaginal canal, and we take a sample, which is then also taken to the lab to see whether we have what we call high-risk HPV type. These are the types of HPV that could lead to cervical cancer in the future. The third test that is important to mention, though we do not do it quite often, is something called a VI-VLI, whereby essentially we put some solutions on the cervix to see whether the cervix will take up the solutions, whether it will be a normal appearing cervix or an abnormal appearing cervix. The most important test, though, that we need to remember from this is the cervical pap smear and the HPV DNA testing, or doing both of them at the same time. When we do HPV DNA testing, and the test comes back as normal, then you can repeat this test every 5 years. When you do a cervical pap smear, you repeat this test every 3 years. All women from the age of 25 and above should get cervical cancer screening. And there's some guidelines that will say, or some schools of thought that say 21 years old. But the bottom line is, by the time you're reaching 25 years of age, you should have started having your cervical cancer screening. How do we prevent cervical cancer? Yes, screening is one of the methods. The other thing is vaccination. We have a vaccine which is called a HPV vaccine. And this HPV vaccine is available even in Avenue Hospital. And essentially what happens is that between all women and children from the ages of 9 to 26, this is the ideal age group where somebody can get a vaccination. And what is really a HPV vaccine? A HPV vaccine is a vaccine that is used to prevent a virus called HPV, human papilloma virus. So what we do and what we recommend is we get the vaccination to prevent these high-risk HPV types from coming, and hence to also prevent or reduce the risk of getting cervical cancer. The take-home message today is, if you're watching this video and you have never had a pap smear done and you have not had any cervical cancer screening done, ask yourself, why haven't you had it done? And when are you going to have your pap smear done? And the good news is, these services are all available close to home in Avenue Hospital, Parklands. That is cervical pap smear, HPV DNA screening, and HPV vaccination. And our clinics are convenient. They run every day from Monday through Sunday, and you're all welcome. Looking forward to seeing you there.